Bring in sports medicine Dr. Sujan Gogu. Dr. Gogu, cardiac arrest is kind of a generic term for your heart stopped. You know, people associate it with heart attack, high blood pressure, or cholesterol, not necessarily with an impact on a football field or an athlete. So how could his heart just stop?
Yeah, so obviously we need to know more details about this incident, but based on, watching the injury take place, the moment it happened, I kind of suspected that this was probably commotio cordis, which is really where there's blunt trauma that comes to the chest, and the impact causes the rhythm of your heart to change, and it goes into a rhythm called ventricular fibrillation, which oftentimes requires CPR and an AED to be in place, where we have to go through BLS and ACLS protocols, which is what really took place on the field, seemingly for 10, 15 minutes, which was really scary and an emotional sight, seeing that on a field on national TV.
Given that it was 10, 15 minutes, from your perspective and your experience, what does that tell you, that it took that long?
Well, I think, the most important thing is the team doctors, the medical personnel, the athletic trainers, they got to Damar Hamlin in about 10 seconds. And they immediately were there to identify that, he probably doesn't have a pulse. He's probably having a difficult time breathing. We need to activate BLS and ACLS protocols to be in place. And the fact that they did that so quickly, probably gives him the best chance to save his life really right now, because had there been any delay in that time period, who knows what would have possibly happened. He might not have had time to make it to University of Cincinnati's medical center had they not responded that quickly.
By all accounts, he's a very healthy young athlete. Is there any way that he can return to playing at full strength? I mean, what does recovery and rehabilitation look like?
Yeah, so, this is going to be more of a complex issue, and we have to see, exactly how he does in the next, couple of days. I still think he's fighting for his life. Reading some reports, although they're not really verified, they say he's still intubated. So there's still a process in his recovery, right? Like, he has to be extubated. We have to see, is his brain sending his heart signals in order to pump blood? Is his lungs, going to open and close normally and do the normal basic functions that we normally do without thinking? The brain plays a role in that. And so we have to see if that takes place. You also got to keep in mind, he was needing oxygen for a long period of time. He didn't have a pulse for a period of time. So did any of his vital organs have any hypoxic injury, meaning did they not have enough oxygen? So I think this is a very complex, issue. I think we need more details, on this. And, we can just hope and pray.
The NFL has worked to protect players from concussions. There's been a lot of conversation around that. Should the league redirect efforts to protecting players from different types of catastrophic impact injuries, or do you think this is really just a very specific, rare kind of incident or accident, rather, that comes along with playing a high-impact sport?
Yeah, I think this is difficult for the NFL to really protect from. I think that this is a rare instance that really happens in sports. I think I was reading the last time this happened was, in a major, 4 sports like NHL, NBA, NFL, and so forth. I think it was 1998 in a hockey game where a hockey puck hit someone straight in the chest, and they, got up and then were unresponsive and had cardiac arrest. So this is a very rare occurrence. It can happen in any sport. It can happen, in baseball, hockey, tennis, any sport, you name it. You just need blunt trauma to the chest. So I think this is very difficult to really protect from.
All right. Well, sport medicine physician Dr. Sujan Gogu, thank you for your time and your insight. We certainly appreciate it, just getting some understanding on a horrible accident and that we're all hoping, he can come out of. Thank you very much.
Thank you. Thanks for having me.